Wonderful. So good afternoon, everybody. Thank you for joining us this afternoon as we host the NHS West Sussex CCG Annual General Meeting. My name is Dr. Laura Hill. I'm a GP in West Sussex and I'm Clinical Chair of our newly formed West Sussex CCG. So today we will be looking back at 2019-2020 at the performance of the three historic CCGs that existed last year and their achievements and the challenges. And there have been many, haven't we, that we've all faced both professionally and personally over that time. We also will look at the journey that we've taken over the last year to come together as the new West Sussex CCG from the constituent CCGs of Crawley, Horsham Mid Sussex and Coastal West Sussex CCG, as we are today. The year that we have been experiencing and how we plan to build on the progress that we've made over this year. Our Chief Executive, Adam Doyle, will take you through a review of the year, and our Chief Finance Officer, Chris Adcock, will take you through our annual accounts. Full details of everything we speak about will be available in the full annual report online, and this is available digitally and on our website. Hard copies are available if you want to request them. So we certainly are in a different time this year. Our AGM is taking place virtually, and I want to thank you all for allowing us to do it in this way so that we can interact with everybody in a safe way, and thank you all for joining. The meeting is being recorded and will be available on our website after the event. We have allocated some time for questions at the end for members of the public, and you can use the comment box to share any questions that you have as we go through the presentations. I'll hand over towards the end to Dom Gurney, who will be able to take us through and guide us through those questions so we can get through as many as possible for you in the time that we have. Okay. So if we move on to the next slide. We obviously hold AGMs each year. They're part of our statutory responsibility as commissioning bodies across West Sussex. The previous three CCGs that I mentioned held their AGMs, and the minutes of those we will note. The AGMs aren't decision making. Those notes will be taken, the minutes of the previous meetings, to our formal governing body, which happens within the next few weeks for formal sign-off. Okay, thank you very much. So the next slide. Coming up briefly. So as I said, before I hand over to Adam, I'd like to add really my own reflections on the last year as we look back, and many of us have faced both personal and professional challenges as we respond collectively as a community to the challenges of COVID-19. I am so proud of how our health and social care system has come together and to respond to COVID-19, to ensure that those who need the health services receive the help in the best possible and safest way, particularly treating those who became most unwell during the pandemic. It has required a Herculean effort from all concerned, and I genuinely want to share my sincere thanks to everybody, our partners across the health and care system and members of the public, because we all do our part, don't we, who have been part of responding and keeping our communities as safe as possible. COVID-19 will certainly continue, I think, to be a health challenge for us over the foreseeable future. But bearing that in mind, we are still keen to recognise achievements we have made over the last year. So I will hand over to Adam Doyle, who will take us through some of these.
Good afternoon, and thank you for joining our AGM today for NHS West Sussex CCG. My name is Adam Doyle, and I have the privilege of looking back on the last year for the 3 legacy CCGs that sat across our West Sussex footprint. This year has been like no other year that I could remember in the NHS. As a clinician and as a manager, I look back on the COVID-19 pandemic that we've been working through and have seen how much this has challenged our health and care system in a way that I could never have possibly imagined when I first arrived in the Sussex system 4 years ago. We have worked together even more closely across our organisations, across the NHS, across our partnerships with the wider public sector bodies to come up with innovative solutions and to fundamentally continue to provide the best possible and safest care for our patients. We are still seeing the effects now as the world around us starts to return to normal. Colleagues across the NHS are working really hard to bring back online as many of the health and care services to keep our population safe and get them treated as quickly as possible. I am incredibly proud of my NHS and public sector colleagues and want to begin today's AGM presentation by thanking all of our partners across our system for their strong support, help and really great ways of working in what has been a truly challenging time. But obviously the year began on the 1st of April 2019 and COVID at that point was not even something we were considering. And the role of the AGM is to look back on the whole year and to consider where we were and how we've developed as an organisation. So we started the year as 3 organisations in West Sussex and we came together as one with the formal merger at the end of the year. We started the year with complex and challenging financial positions across all 3 organisations, and significant work was done with partners to identify and achieve efficiencies across our financial areas and also to improve our financial position by the end of the year. We had statutory legal directions in place for Coastal West Sussex CCG, Crawley CCG and Horsham Mid Sussex CCG. And that related to the way they were working and how they had historically been able to improve services. I'm incredibly proud that by the end of the financial year, we had all those legal directions lifted, which is a credit to all of our hard-working team, our partners and our governing bodies. And there was real progress in terms of how the CCG worked with our partners, both in West Sussex and across the wider STP footprint. In particular, we were an active partner in the STP, our Sustainability and Transformation Partnership, as it progressed to become an integrated care system. So, who are we? For those members of the public who may not be familiar with the commissioning landscape in West Sussex and our history, in 2019-20, we were 3 organisations: Coastal West Sussex, Crawley CCG and NHS Horsham Mid Sussex CCG. But collectively we were responsible for commissioning healthcare for almost 1 million people and had a budget of just over £1.4 billion. The organisations were membership organisations, meaning they were led by GPs in their practices in their area, and together the organisations worked to ensure that everybody had access to high quality healthcare. In terms of simple commissioning, we are responsible for planning, buying and monitoring health services for the people of West Sussex. But to do this well, we must do it in partnership with hospitals, community services, mental health services, pharmacists, dentists, the local authority, voluntary groups and our local community to ensure we are planning and buying services that meet their needs. So, improving the way we work. Whilst we were 3 legal entities at the beginning of the year, we had already started to come together as organisations and we had one leadership team across Sussex and then East Surrey CCG. We agreed to operate in one way with one operating plan and model across all of the Sussex CCGs and did this in partnership with our local providers. During the year, we developed our plans for a formal merger of the CCGs, which would allow us to align our focus to the footprints of our local authorities. There were already really strong working relationships with West Sussex County Council, but with our member practices, with our governing bodies, we felt the three CCGs coming together to work as one organisation with West Sussex County Council in a joint commissioning and integrated approach was the right thing for our local population. We're also incredibly proud of the fact that we achieved our ICS status, and the three CCGs started as active partners in the Sussex and East Surrey STP. But we were recognised early in this financial year for the hard work we have done in breaking down the barriers between commissioners and providers, bringing our organisations together. And as a result, we became the 14th system in the country to become an integrated care system. It's really also important to recognise that's a significant improvement for our system, as just under 3 years ago, all of the STPs were given a rating, and the Sussex and East Surrey STP was rated in one of the poorer performing areas in the country. So to have done the work that we've done, to have made ICS so quickly is really, really important for us, but also really important for our population. All of that is a rather structural look at the organisations in which we've led, but there have been some real demonstrable key achievements that I'd like to highlight to you today that we're incredibly proud of. So we wanted to have significant focus to reduce the time people waited to be discharged from hospital. And the launch of the Home First initiative across the whole of West Sussex, with Western Sussex hospitals and our local authority partners, to support people to have their assessments in their home rather than waiting in hospital, has been really, really important to us. That was incredibly important when we were managing our COVID population, and we've seen some significant improvements in the areas that we're very proud of. Ensuring we've had dedicated support for those that are frail and vulnerable has also been really, really key. And in Crawley, we launched a single point of access for people for falls and fractures. And this ensured that when somebody had experienced a fall or fracture, they were quickly referred to community-based health and social care services to improve their strength and balance, and to also consider whether any other matters in the patient's home or how their care was arranged that meant we needed to manage their risks in a different way. A focus on mental health has been really, really key for us, particularly looking at how people can access psychological therapies and to also increase our diagnosis rate for people with dementia. We were really, really pleased that we became a trailblazer in Bognor and Crawley with 2 mental health support teams that supported schools to help our children and young people as we were managing their health and care needs in a way that was more holistic, but also gave them the ability to manage their own care in a way that was really effective. We've worked with our local GPs to improve the holistic care available for people across our area. So we've got a new social prescribing scheme in Worthing and Shoreham that's preventing people from becoming homeless. And we've worked through connecting people to local activities to reduce loneliness and social isolation. We've also spent a lot of time looking at improving the end of life care for our population. And we've benefited from a 24/7 coordinated end of life care service. We call it ECHO, the End of Life Care Hub, that operates throughout the year, 365 days a year, to ensure that people can access the right services as they're moving through their end of life care pathway. And similarly, we've promoted a digital solution for our GP practices in East Grinstead to plan their care, to work with our population to help plan their own care, and that has been recently shortlisted for a Health Service Journal Value Award. So we're feeling that we're getting the benefit of working at scale across West Sussex, but we're still able to deliver things locally for our population. We have had a focus on primary care, and we were one of the first areas in the country to secure 100% coverage of primary care networks. Basically, all of our general practices have come together to work in a network model where they can begin to offer more personalised, coordinated health and social care to their populations. 100% of patients in our area have access to extended access appointments at evenings and weekends, and we've managed to offer more than 65,000 appointments in the last year. General practice at times has had some challenges in West Sussex, and we've been able to provide additional financial support where possible to support those practices to help them manage some difficult issues they've been dealing with. It's also really key, and one of the statutory responsibilities of a CCG, to ensure that we are listening to our populations. And we launched Our Care, Our Health, Our Future initiative to engage the populations and our communities on the NHS long-term plan. The NHS long-term plan was a document that we received at the beginning of the year that set out really the NHS future direction. And our system across Sussex and our West Sussex system was asked to write a comprehensive response. We heard from over 850 people through a range of different channels, and we ran a two-phased approach to gain feedback on our response to the longer-term plan. And we aimed to reach communities that we haven't heard from before, and we felt that we managed to have some real different conversations with members of the public that we haven't always spoken to before. We've also carried out a number of focused areas of engagement in West Sussex, particularly in the mental health redesign of inpatient services, and also looking at our community services in rural Chichester. We expect to get a good assessment for all three CCGs for our NHS England assessment on our public engagement. I've worked in the system now for 4 years, and for those that know me well, know that I've spent my time running different numbers of the CCGs across the Sussex system. And the one thing that I've learnt more than anything is we have achieved a heck of a lot, but predominantly due to the hard work of our member practices, our governing body, but also our staff. So the people that work for us are really important to myself and the wider management team. And to be frank, it is not always easy going through significant change and moving from 3 CCGs into 1. We also then had to get the organisational restructure done and get it embedded. And as soon as we were embedding the process, we were hit by COVID-19. So that also affected our teams, and we had to ask a vast number of them to work from home, but also to still work from home whilst working in their new directorate or their new team. And our teams have risen incredibly to the challenge. And it's a real credit to each and every one of them that they've accepted the new ways of working, they've embraced the new technology, and they continue to operate to the highest standard in the toughest of times. It was also important, though, and myself and the interim chief officer, Karen Breen, took on the personal responsibility, knowing that we still had areas that we had to improve from our previous staff surveys, that we would aim to improve our staff morale whilst we were also going through COVID, because it was our resolute commitment that at the end of COVID we needed to have an organisation that was resilient, stronger than it was before, but with really engaged staff to help us make the changes that we wanted to. And there are 4 key metrics that we looked at, and there's a vast number that sit below that. But it was really important that our staff, our team members, saw health and well-being as a priority for our organisations. In 2017, only 30% of our staff felt that we thought that was an important thing. I'm really pleased that in 2020, 3/4, 75% of them say that they believe that is a priority for our organisation. We're not complacent. That still means we've got 25% of our staff that don't feel that's the case. But I'm confident with the plans that we've got in place. I'm confident by the work we've put together that we'll see those numbers improve over the coming months and years. We've also been checking with our staff, are they feeling supported by their line manager? And we've seen a 10% improvement in that over the past 3 years at 82%. It's also really important in these times that everybody is clear on their role and their expectations. And 80% of our staff feel that they are really clear what's expected of them and really clear they've got all the equipment to do that well. We have asked the question of our team members about what does it feel working from home, and for those that know me know that even I've struggled with the fact that I've not been able to interact with our people on a day-to-day basis. But what we've seen from them is they're saying that about 75% of our team members feel that they're getting the right work-life balance in place. So we're going to continue to monitor that, because we have had reports that at times when you're working from home all the time, it can be difficult to switch off, and when does work end and home begin? So we're giving some thought to that as a management team collectively. So what are our priorities looking ahead? So first thing out of the bat has to be the safe restoration and recovery of health services across West Sussex. That's in line with the phase 3 letter we've received from central government, setting out the clear expectations about how our services should be up and running following COVID-19. In our plans to restore services, we want to make sure that no community is left disadvantaged and that we address health inequalities rather than add to them. We know that there are clear areas in terms of waiting times for treatments across specialties, in terms of 1 and 2 month waits for cancer treatment that need to improve. And we know that some of our waiting lists have been impacted by COVID-19, and we need to get people seen as quickly as we can, as appropriately as we can, to ensure that they can be seen as quickly as possible. We've made a real commitment to mental health services investment in West Sussex, and whilst we've met the mental health investment standard within our 3 CCGs, we cannot be complacent, and we will continue to focus on improving the outcomes for people with mental health. The further development of primary care and primary care networks, in particular, the addition of new posts within the communities to support local populations, including physicians associates and first contact physios. So that's really given a sense as to what the year has been like. In my closing remarks, I want you to recognise, first of all, the significant work that the 3 CCGs in West Sussex achieved in 1920. I want to acknowledge the really hard work of all of our team, of all of our partners, of all of our providers in response to the COVID-19 pandemic. And really, I want to thank our governing bodies, our member practices, and also all members of staff from the former CCGs for all they did to progress commissioning of their areas and for the progress that they've made. Finally, we're not complacent. There is more work to be done. We recognise the challenge for the next 6 months, but I feel increasingly more confident, and I've been more confident every year that I've worked in Sussex, that each year will make another big step forward. And I believe we're already making that in 2021. More work to be done, but I'm absolutely confident that the governing body are up for that challenge and the organisation is ready to respond to the challenges that we'll face. And with that, I'll hand over to Chris Adcock, our Chief Finance Officer, to take you through our annual accounts. So over to you, Chris.
Thank you, Adam. My name's Chris Adcock, as Adam said, Chief Finance Officer of the CCG. I was just reflecting myself that one of my first responsibilities as I joined the CCGs last year was to attend the annual general meetings and present on the financial statements. And just listening to Adam, an incredible year it's been. It is important to remember that there were 3 statutory organisations in 2019-20, and so there were 3 separate sets of accounts. And collectively, the 3 CCGs that make up West Sussex CCG now spent more than £1.4 billion on healthcare. There was a varied position across West Sussex at the end of the year, with coastal West Sussex delivering a small surplus in line with its control total, whilst Crawley and Horsham Mid Sussex CCGs ended the year with a deficit, and they were adverse positions against their original plans and the centrally prescribed control totals. All CCGs did operate within their running cost allowance as a result of the joint working arrangements that Adam has told you about earlier. So in terms of how we worked last year, for coastal West Sussex, a plan was agreed for the year end in Crawley, Horsham and Mid Sussex, and we were unable to meet the financial targets set out by NHS England due to the scale of the financial improvement this required, and therefore the CCGs worked with regulators to set revised plans for the year-end position. And it was a challenging year for all three CCGs. All had significant stretch targets to achieve, and each had their own particular challenges when it came to achieving their financial plans. In particular, Crawley CCG and Horsham and Mid Sussex CCG maintained ongoing dialogue with NHS England in respect to the financial position, and this supported a formal reforecast during Q3, and the eventual year-end position that we reported was delivered in line with that. Aligned incentives arrangements that have been established with providers, especially the Coastal West Sussex CCG agreement with Western Sussex hospitals, but also our increasingly collaborative working across the local health system, helped the CCGs to achieve efficiencies, as did the focus in areas where good results were achieved in respect of medicines, and in particular in relation to the cost of biosimilar medicine. As Adam has said, by aligning the management support for the CCGs, we were able to work with our partner CCGs across Sussex much more effectively, and that partnership work meant that all the CCGs in West Sussex met their targets to reduce running costs in the last financial year. On the next slide, we're looking at the summary of what we spent our money on. You'll see that more than 50% of the funding that's passed down to the CCGs is spent on hospital care. And the other services which we spend a large proportion of our money on include community services, which of course allow people to be treated closer to their own homes, prescribing for all of the medicines and treatments prescribed to people living in West Sussex, mental health services that include services focused on identifying those who are struggling with mental health issues and preventing them from going into crisis, and those who need urgent help. In Coastal West Sussex and Horsham and Mid Sussex, the CCGs also had delegated responsibilities for commissioning primary care during 2019-20, and this allowed the CCGs to put locally commissioned services in place and provide funding for practices at risk. For example, Crawley did not have delegated commissioning arrangements in that financial year. So in the next slide, in respect of the audited accounts, each of the accounts of the CCGs have been formally audited and approved. Now, this might seem like a small task, but it's actually a very significant challenge for the finance team to complete 3 sets of accounts and close the accounts for each organisation whilst establishing the new financial governance arrangements for the new CCG. But this also happened in the context of the COVID-19 emergency response phase, which presented a whole series of additional challenges to the teams and resulted also in an extended audit programme timetable. So what would have been a significant task in any eventuality was even more so. And it's a credit to the team that we had the positive results for the financial statements and the accounts. And I'd like to say my own personal thanks to the CCG's finance team for their efforts in respect of this. Looking forward to 2021 and the impact of COVID, the 3 former CCGs obviously formally merged on the 1st of April 2020 to form West Sussex CCG. And in a normal year, that would mean we would set our financial plans and agree our year-end positions, which we were clearly working towards. We've made a number of submissions in this regard. And the in-year plan deficit for the CCG was £60.3 million. Now, that was 26.2 million adverse to the financial improvement trajectory target that had been set. But it did represent a reduction of £10 million compared to the combined position at the end of 2019-20. Now, associated with that position, the agreement of the targets for the year would have secured further resources through the Financial Recovery Fund, which is operated nationally and would have been worth £34 million to the CCG. And this would have enabled us to achieve a financial break-even position had we been in a position to submit the plans in line with the target. But the submitted plan did actually exceed this originally by £26 million. So further negotiations happened with NHS England which resulted in an agreement for additional financial recovery funding to be allocated to the Sussex system in return for the identification of further improvements of around £9 million of savings. So this would have enabled all organisations in West Sussex, all organisations in Sussex, including the West Sussex CCG, the financial break-even had the submitted plans been delivered. However, as COVID-19 affected the country, all CCGs were placed in legal directions by NHS England, and there was a suspension in March of the overall NHS financial regime, including the planning and contracting processes, in order that NHS organisations could focus on the COVID-19 emergency response. NHS England, an improvement, then also implemented a revised financial framework from the middle of March, and it was which was expected to deliver break-even performance for the first 4 months of the year for all NHS organisations. And we've now been operating in that financial regime during the current financial year. So this pause inevitably put on hold further transformation programmes, because of course those programmes are dependent on good, close system working, particularly between clinicians and so forth, in terms of the planning of those arrangements. However, and the emergency response requirements made that a much more difficult thing to achieve. However, the response will, of course, continue to impact on the underlying financial position of the CCGs and the system as a whole as we restore services and we become clearer about the impact on the cost of providing healthcare services in the future. I'll stop there, Laura, and I'll hand back to you if that's okay.
Hi, Laura, I think you're on mute.
There we go. Deary me. The number of hours we've been spending on these sort of Teams calls, I do apologise, everybody. So thank you, Chris, and thank you, Adam, for taking us through the sort of highs and lows of our last year, and particularly the financial challenges that we've had. If I take us on now to our section where we invite questions, I can see that a few have been posed, and ask Tom to help chair this aspect of the AGM. I'll hand over to you, Tom.
Thank you, Chair. So for those who don't know me, my name's Tom Gurney. I'm the Executive Director of Communications, People and Public Involvement for our CCGs. And this is a really good opportunity for those attending to ask questions of the panel. We've already heard from Dr. Hill, of Adam Doyle and Chris Adcock, but also really pleased joining us. We've also got Malcolm Dennett, who's the lay member for finance, Jennifer Graham, lay member for governance, and Dr. Ketan Kansagra, who's the locality representative and a GP. So I'm encouraging all those who are watching to ask us questions. That you can see that there is a ability to ask questions on the side panel, and we've already got a few coming in. Also, thanks to those who have submitted questions beforehand, and so I'm going to go to those questions first, and then we're going to go into the ones submitted live. So the first question, really good one, around CCG mergers. So this is how have the CCG mergers benefited the population of West Sussex? So really, really good question, and I'm going to first go to Dr. Hill. So do you want to take that?
Yes. Thanks, Tom, and hopefully you can hear me this time now. I've unmuted successfully. So I think thank you for posing that question, whoever that was, and a really good one. Of course, one of the main objectives we had as we formed the West Sussex CCG was that our then coterminosity with our county council would provide us a really good platform for furthering some of the really good community-based improvements that we hope to do for our populations, as well as the wider service improvements. As we went through the COVID-19 pandemic, clearly that was our biggest challenge as a newly formed CCG, and I would reflect that the way our providers, the commissioners, our county council, our district and boroughs came together to respond to COVID-19 really was so impressive. For me, that shows that we have the foundations now of a really good working relationship to start now to put into place some of the benefits that we hope to see as a West Sussex CCG. To be able to ensure that we responded well for those who were unwell with COVID-19 and to those who were isolating and shielding themselves at home, and support our services to maintain safe and effective emergency services was quite something, to be fair, especially right in the depths of sort of April, May time, when we saw the sort of height of numbers. But perhaps I am slightly biased. I'm a West Sussex resident, so I benefited and saw some of the literature that came out to households that supported us also to keep well, which was a joint approach. But perhaps I can turn to Malcolm Dennett, who's our lay member for finance and performance in our governing body. Malcolm was a member of the historic coastal West Sussex CCG and won the role in the new West Sussex CCG. And your perspective, Malcolm, would be very welcome on how you view that.
Good afternoon, everyone. I won't restate what my role is, as you've already heard that from Laura. I think my perspective from having been involved in one of the 3 previous CCGs compared with now, I think we're able to come out with joint messages to the executive team on the priorities. That necessarily results in real benefit to our patients. So that single message, as opposed to perhaps slightly nuanced different messages that we had previously, which then had to be prioritised, I think that is really important. So we avoid that duplication of effort. But what is also particularly important is the linkage across the various committees of a governing body, be it quality, finance or performance, is much more streamlined, and that is also particularly important. Now, many members of the public always say the NHS has got high administrative costs. We will have reduced our administrative costs dramatically as a consequence of the mergers, both in terms of what you've already heard has happened with the executive team, but also the reduction in the number of governing bodies. That money is available for frontline services. So I think that's particularly important. And if you think of the period that we've gone through and are still going through with COVID, it would have been inconceivable that that could have been managed if we'd had across Sussex the 7 CCGs. So there will be real benefit, and those benefits will increase as we go forward, as laying a really strong foundation for joint improvements. So I think that is my experience of why I believe this will be really beneficial for our patients and our public. Thanks very much.
Thanks, Malcolm.
Thanks, Laura. Thanks, Malcolm. Really, really good answers there. I'm going to stay on the theme. We've had a merger. We've had another question coming up, follow-up question coming up on the chat, which will go to Chris Adcock. I'm going to go over to Chris Adcock, which is, what is the expected overall financial savings going forward from the merger? So Malcolm mentioned some of the savings, but I think I just wanted to stay on the theme. So what is the expected overall financial savings going forward from the merger? So Chris, are you able to take that?
I can't quantify that actually in totality, Tom, and remember so many of the reasons for the merger were to bring things together so that we could do them differently. So I think we'd have to, I can't quantify it specifically. We did provide an indicative financial saving, which was basically the point that Malcolm raised against the running cost. I don't have the number to hand. We'd have to follow up with that.
Okay, thanks, Chris. So another question which came in before we went live today, which was around the ICS. We heard in Adam's presentation about Sussex became an ICS on April the 1st, which is extremely good news. But I think the obvious question really, I think, here is how will the ICS improve the NHS across Sussex? And I think, Adam, you're perfectly placed to take that one.
So thank you, Tom, and thank you for the person that asked that question. So first of all, the Sussex system has been on a significant transformation journey for the past 4 years, and I think when I look at how all of the organisations perform now versus how they performed 4 years ago, it's pretty impressive, really. So we have no large NHS organisation that isn't rated good with outstanding features or outstanding by the Care Quality Commission. We don't have a CCG in any form of legal directions or special measures apart from the national COVID elements regarding CCG management at this current point. And also we have improvements in all of our local authorities from where they perhaps have been historically. That's particularly pertinent for the West Sussex population. So we've been building as a system over the past 4 years to work very differently together. So the level of collaboration across all of our providers, the level of collaboration across all of our commissioners, we've done a lot of work to get to this point. So I see the ICS now as the way of us working truly with our communities and our clinical teams to ensure that we together can make some quicker and pacier changes to the system in a way that doesn't get caught in so much organisational bureaucracy, but also because we've got good trusted relationships across our organisations, we're able to bear more risk with each other. So I would hope that we would see a faster improvement into health outcomes for our population on the back of us working really closely together. And I know Dr. Hill has given this example, but we made the application to become an integrated care system at the end of the financial year, and going into COVID was an absolute test of our working relationships, how we would bear risk with each other, how we would manage difficult times where we may have had in one trust not enough PPE for that particular sort of 5-day ahead look, and how we would share that across all of our system. All that was a really positive thing for our system. So I think we've demonstrated at a time of real crisis how coming together in the way that an ICS operates means we can make faster changes for our population and improve their outcomes.
Great, thanks, Adam. So we're going over to the chat, and they're coming in thick and fast now, which is really, really good to hear. Good to see. So there's one around mental health. So the question is, how do you feel that the communication between physical health and mental health stands now here in West Sussex? Is it the same, or has it altered in any way? And I think I'm going to go to Dr. Hill to lead that one.
Thanks, Tom. Yeah, and thank you for posing that question, because I know we've had feedback not just from our clinicians about how important this is for patients, but also from the big health and care conversation, didn't we, Tom, that was mentioned in some of the previous slides as an area that really our public want us to think further about. The importance between joining up communication between physical and mental health services, it is one that we really want to put some focus on moving forwards. Perhaps I can invite my colleague Dr. Kansagra, who is a local GP in West Sussex, to provide his perspective, and then I'll pick up further.
Thank you, Laura. Good afternoon, everyone. It's always a challenge, and the services that we have are working better with each other year on year. And I think it's about developing that relationship on an ongoing basis. I think forming into an ICS will help accelerate that. So that will always be helpful. Quite often the GP is the conduit between mental health services and any physical health issues that may arise. And I think we as clinicians need to be aware patients with mental health issues often has physical health issues or vice versa. And that's always being highlighted. There's also various initiatives that we have locally that help. So we have learning disability checks, which help highlight any physical issues that any patients may have. We have SMI checks, which are serious mental illness health checks that GP practices can provide. We also have a time to talk for health service for patients who have long-term health conditions. They can access the time to talk service just to discuss their health issues. All of these little elements help get the picture more collaborative working, and year on year we're building on that. So it's never perfect, but it's always an ongoing picture that we're trying to improve. I don't know if Laura had anything else that she wanted to add.
Thank you. Thanks, Dr. Consalgra. Yes, and I suppose tagging on to that, whilst we've made quite a few improvements to those interfaces for adults, which you described very ably, thank you. I suppose it is worth highlighting our commitment with our system partners, providers and commissioners and our local authority to start to work on improving the children's emotional health and wellbeing services that are out there. Those who joined our recent governing body may well have heard the debate and discussion around the review that we have completed as a collaboration of system partners and our sort of refreshed commitment to now start improving services for our younger population. So I do hope that when we are back this time next year, we will have some further successes to share with you. Thanks, Tom.
Great, thanks, Laura. So we've got a question here around flu, which I think is on everyone's lips, isn't it? So it's, can the CCG confirm that there will be sufficient stocks of flu vaccine to fulfill the promise made that all over 50s will be able to access one? So it's a good question. I think our chief nurse, Alison Cannon, leads on flu, but I think Adam, you're going to take this question on her behalf.
Yeah, so thanks, Tom. Yes, so you're completely right. So Alison Cannon's our Chief Nursing Officer across our CCGs, and she has the responsibility for seasonal flu across the Sussex system this year. And of course, that's an enhanced role this year because of the increased requirement to ensure we've got the appropriate stocks of vaccinations for all the cohorts, including those that are over 50. So we're working really closely with Public Health England, with NHS England's primary care team and our providers to ensure we have the required stock of vaccinations for those cohorts. And we modelled the numbers some time ago and have sent those in. We've been given good assurances that we will have them and they'll be here. We're now just working through with NHS England when we'll get the supply in, and then how we will therefore make sure that that's managed and sent out to the relevant people to make sure we can vaccinate our population. And what we've also asked, we've asked Alison to give an update via the Chief Officer's report to the governing body in public in October on progress on this. So we'll make sure that we're clear when and how in that report, and that meeting is the beginning of October. So we'll make sure we've got everything prepared for that time. Thanks, Tom.
Thanks, Adam. I'm gonna stick with you though, Adam, because I'm really pleased to see one of our partner colleagues, Amanda Jupp, our council colleagues, is listening in, and she's asked a question, which I think is a really important and really good question. Is, as we are moving back, hopefully, to almost business as usual, how will the CCG effectively manage the waiting lists for surgery and treatment that have been put on hold during the pandemic, and will this come at a greater cost?
Okay, so probably a few angles to that question, if I may, Tom. So the first piece is we've modelled all of the patients that are in the backlog of waiting for their treatment pre-COVID, if that makes sense. It's probably important to recognise when we're into the first wave of COVID-19, we did minimise significantly the numbers of operations that we were able to offer across the wider system in line with NHS England improvement guidance at that current point. And particularly for West Sussex CCG, Western Sussex, up and prior to the COVID-19, did have a slightly larger 52-week waiter, so people waiting over a year, than we probably would have wanted as a collective system. And we had plans to get those patients seen throughout the year, but unfortunately, when COVID happened, we were unable to make that happen. So what we're doing now, we're working with each of our trusts on a week-by-week basis to assess each of our patients that are on those waiting lists and to ensure that we can get them seen as quickly as possible in order of clinical priority, and also to ensure that we are looking at each patient to get them seen as quickly as possible. Each of our trusts have come together to look at their collective waiting list, and we'll be assessing that and asking them to consider what else they will need to do to therefore make sure we can get our patients seen quickly. In terms of the cost, as Chris would probably cover, we are not still completely sure what the financial arrangements are for us for the rest of the financial year, but we have put forward what the size of our waiting list looks like to the centre. To be clear, to clear that waiting list, this is the amount of money and resources we would require for our system. But we're having a weekly chief executive restoration discussion. We're very fortunate that Karen Breen, the interim chief officer, is coordinating restoration across our system and working really closely with our providers on that. And then it reports to the joint committee of our CCGs, and at our next committee, Karen will be updating the joint committee about where we are in progress with those aims.
Thank you, Adam. So I'm just going to read out, it's not a question, it's a comment, but it's from one of our partners. It's from Sir Peter Bottomley, the MP. Really pleased that you joined us, Peter. And it is thanks to all your colleagues and to all of you. On behalf of the local MPs, I thank you for your regular opportunities to be briefed and to be discussed with you and the CCG. So thanks, Peter, for that comment. Really appreciate it. And just on that, particularly during the COVID-19 response, we have tried extremely hard to make sure that all our partners have been involved and briefed. So Adam Doyle held weekly briefings with the MPs and Healthwatch from a patient point of view. We've been in regular contact with our council colleagues, and so hopefully the stakeholders have felt they've known what's happened and have been part of it and helped us come up with the solutions during what has obviously been a very difficult time. I think we can always do better. So anyone on this call or other colleagues, anything how we can improve our communications engagement, speaking as the executive lead for that area, please do contact me directly. But thanks for that comment, Peter. So I'm gonna there's a question around dentists here. So is the CCG aware that local dentists are applying additional charges for provision of PPE? For example, an extra £34 for hygienist appointments. Is there any governance in place? So I think, Adam, I think you're the best. Obviously, you don't lead on dentists, but you're the best person probably to take this question.
Yeah, thanks, Tom. So first of all, it's a really great question, and I think we will want to, out of this, follow up on that particular issue, if that makes sense. So if you can just make sure you link in with the individual that's raised it, we can therefore follow it up directly, because it's a particular specific, I think, sort of case. But in terms of dentistry, we are not the responsible commissioner for dentistry, but we have a responsibility to ensure that all of the local services together are following the right approach, and also you've got the right services in place. So we've asked that across the South East that each of our systems, so for Sussex we're very fortunate that Penny Ford, who is our Executive Managing Director for West Sussex, she's coordinating the response to dentistry across the whole of Sussex. So we'll make sure that we get this tied in better on the back of those discussions. But I think it's probably important that we've been working really closely with our Health Watch to also hear the concerns regarding dentistry, and to make sure we as a system can work closely with NHS England as the commissioner to resolve those issues. So I think on the back of that question, Tom, perhaps we can take an action to ensure we're creating sort of a way of hearing all the dentistry issues, to make sure on a weekly and monthly basis we can make sure they're being reported correctly to NHS England, so we can make sure we get the right response for them going forward. But I think it's important for whoever asked the question. We have heard quite a few concerns from our population about dentistry, so we're taking it very seriously, hence why we've asked Penny to oversee this for us. And I think if we agree that we're going to take all of these actions and put them on our governing body action log for October, then the West Sussex governing body can feel assured that we're taking the right actions regarding that particular issue, and in the round about our approach to dentistry, if that's okay.
Thanks, Adam. So just to reiterate the point, so any questions that we either are unable to answer or we don't get time to answer, we will have full responses to those, and we'll publish those with the board papers for the governing body board paper in October. There is a question that's come in, which I think is another one that I think we need to take away to the executive lead, which is we at Sussex, Mid Sussex Healthcare PPG, understand that the only COVID hot hub in West Sussex will be sited at Horsham Hospital from October the 1st. What arrangements have been made for children with high temperatures not being allowed to go to their surgery, but will have to go to Horsham? I think the person I think that needs to go to is Wendy Carberry, who are executive for primary care. So we'll be taking that away and getting a full response to that, as we will the other questions. We do have one though that I think we can talk about here, because it has been one of the big silver linings, if you like, in the COVID response, which is about the innovation and particularly the use of technology. So the question is, COVID-19 has accelerated the move to more technology linked up NHS. What lessons have been learnt on the use and accessibility of technology, and how do you envisage the future will develop? And I think what I'd like to do is, because primary care is a particular area where technology has really accelerated over the last few months, and I think having the clinical perspective from Dr. Consagra and Dr. Hill would be really good to hear from a primary care perspective, the good and maybe the bad as well. So I'm going to go to Ketan first, if that's okay.
So about the technology, I think it's been amazingly helpful in the initial few months, actually, because we were not able to see patients the way we wanted to. They weren't necessarily that keen to come into our buildings, and we had the duty to protect them and other patients and our staff. So having the ability to have video calls and be able to, for patients to be able to send photos back, which can go automatically get saved in their records, really did help a lot of the consultations. And actually, it's been very helpful for lots of patients, because they've been able to arrange appointments even when they're at work, because they don't have to travel to see us and wait in our waiting rooms. They literally just have to take a call or a video call at a certain time for 10 minutes. And most patients are able to dip out of an office or a work environment for 10 minutes to access a GP call. So it's really helped in lots of ways. I think we as clinicians do miss seeing our patients face to face. Whilst video technology and phone calls and photos are all really helpful, sometimes you can't beat a face-to-face consultation, because you can pick up on the small nuances that tell you there's something else going on. And obviously, we are still seeing patients that we physically have to examine, that they an examination has to be done physically. You can't really do it in any other way. So I think going forward, some of this will keep, and where possible, we'll still try and encourage patients to phone in or video call in or be able to send photos, because that I think saves them a lot of traveling time and waiting time, and just makes it more efficient for them to carry on with the rest of their day without being too interrupted. But hopefully, as the risks of COVID decrease, we'll also have the ability to have more normal face-to-face appointments for those that need it or want it, because we like that as well as clinicians, I think. Laura, did you have any thoughts?
Thanks, Kesson. Thanks, Tom. Yes, and I suppose my experiences and those fed back to me from both our patients and the sort of wider population across West Sussex have been similar. There are elements that were extremely helpful, and actually in terms of some of the groups of our patients who find accessing normal face-to-face appointments tricky for various reasons, then some of this definitely has a role in future, and we need to be flexible and listen both to the views of our patients and public, as well as the views of those clinicians who operate these systems, to ensure we get the best blend going forward in future. I suppose when we come to hear back some of the further feedback from the big health and care, your socially distanced conversations, Tom, that the team are going out with, I'm really keen to learn what our patients and public have felt about some of those services, good, bad and ugly, so that we can make sure we flex and improve things for the better.
Great, thanks. Thank you. That's really good to hear the clinical perspective around technology. So we have encouraged our staff to attend the AGM, as well as the public and stakeholders, and we do have a question from our staff, which is around the organisations. So our organisations, for those who don't know, we've been through significant change, and there has been mergers, and we are evolving. We continue to evolve. So the question really is, what in light of restoration and recovery, what is the future of our CCGs as an organisation for our staff, but also around how we're working in our offices? So some of our offices are closed. We're looking at opening some offices. So what's the future plan? So Adam, you're the perfect person to go to.
Okay, well, so first of all, so thanks for the question first of all, and I think a few things first of all. So the CCGs are now the statutory responsible body for the three areas, and we see that as a clear part of the NHS architecture. But our CCGs would need to work out how they position themselves as part of an integrated care system, and what their role is, and how that comes together. And we'll be having those discussions with governing bodies. I know our three clinical chairs, particularly Dr. Hill, have asked me for my thoughts of that, and we'll be discussing that with our governing bodies and then our staff groups over the coming weeks and months. It's been really tricky for a number of our staff. I'm aware of that, particularly about the whole issue about how we're working. So pre-COVID, first of all, the issue for us was we were very clear that we were going to be starting to consider all of our offices across our organisation and how we were working. But this time last year, when I was doing the AGM, I never thought I would be doing an AGM virtually. So let's be frank, that's a massive change. Now there are COVID-19, there will be some disruptions to how we live our lives and how we operate our professional lives that will remain in there. So to be honest with you, I'm very clear with the leadership team, and myself and Karen Breen have discussed this extensively, that we want to ensure that we retain the best parts of what COVID has given to work-life balances, people working from home, not feeling the need to be in an office 5 days a week, and also minimising significant travel time, because we are one corporate team working across 3 CCGs. Getting from Chichester to Bexhill has not often been an easy journey for someone to make. If they can hook in to see their director for a one-to-one or speak to their line manager virtually, I think we can all be clear that's a more effective use of their time, and also a better use of taxpayers' resources. in the context of that, every penny that we get to run the organisation, we're not spending on running on delivering services. So I've got a value for money test. I've always got to ask myself, as chief executive, is that penny best well spent in keeping an office open or not? So we're currently working through how we start to bring people back into their offices, but we also need to consider the 5 buildings that we have occupied historically. Do we need to still be in them collectively? All of our staff have gone through a risk assessment for how they can work at home and how they can manage that. And as we start to bring people back into offices, we'll also start to consider that. We've been quite careful with our approach, and I think when you're looking nationally about issues regarding local lockdowns and what that means, I think we need to apply due care and attention, and also ensure we are following government guidance at this current point. And we have to question, do we need people to be in office today, or can they do their role well from where they're working? So that's the key part, and we'll come to a decision over the coming weeks about which of our offices will be open to the same footprint, and what decisions we'll take about whether we need to have them operating going forward, because I'm sure the governing body will hold me to account for the money that I could save if I didn't open one, and what we could therefore reinvest that in. And to be frank, you would expect the taxpayer would ask that question as well.
Thank you, Adam. So this is a question around governance. So which is we've got the perfect people on the call for this. So this is around obviously key for CCGs to have clear governance and decision making in place. How have you ensured that you've been able to have good governance and decision making during COVID-19? So can I bring Jennifer in?
Hi, I'm Jenny Graham, lay member governance for West Sussex. I joined the CCG actually on the 1st of April, which was right in the thick of COVID. So I'm really just getting to grips with everything, and to me this is the way of working that I've got used to, really. In terms of the governance, there's been a lot of work done. And the governing body has spent a lot of time discussing the governance levels and the appropriateness of them at any one time as we've gone through COVID. So we have had governance. We had weekly calls at one point in terms of the chairs and the lay members for governance across all 3 CCGs in terms of decisions taken, etc. We've changed the committee structure. So we've actually got committees in common as well. So we've got a joint committee in common. We've got the joint quality committee in common, joint finance and performance committee in common, and the joint audit and assurance committee in common. So we're working far more joined up just to make sure that we're focusing on the right things. The governance is in place, and we're, the governing body are being informed and involved in the decisions that they should be. But we're looking at this again, we're looking at it on a regular basis to make sure it's still appropriate, in line with guidance that we've got from the centre, and in line with the changing status of of the COVID situation. So the audit and assurance committee is, as it says, is got to be assured, and we're still, we're receiving lots of assurance reports and lots of evidence. The different thing at this time, I think it was Adam that mentioned the legal directions, is obviously the role of the CCG at the moment in the governing body is slightly different in terms of the decisions it can take and not, because some of the things are being handled, the procurement, a lot of things are being handled centrally. So the roles changed slightly. I would say this role is not exactly what I thought I was coming in to do, but it's slightly changed because of the COVID situation, and we're no different from other CCGs. In fact, I think we've handled it really well in terms of working closely together as 3 CCGs across Sussex for the benefit of the population and across our, the partners and ICS. Does that answer the question?
Yeah, thanks, Jenny. That's really, really good to hear. So this is a question which, again, I think we would want some clinical perspective. It's probably not one you can answer specifically, but maybe it's something you can just give your reflections on. Then we can go away and get some specific points. So COVID-19 has left some people, including young patients, with post-viral fatigue, and a growing few with the more serious long-term fatigue, which has been called long COVID. What plans are in place to support this group of patients who may be not able to work, look after their families, or even themselves? So, Ketan and Laura, maybe not one you can actually answer, but again, it would be good to just get your reflections.
Yeah, so there was an article in this week's BMJ about the long-term effect of COVID. So that was a very helpful article, and certainly I've shared it within our own practice. I'm sure other GPs have done the same. I think the effects are going to vary from individual to individual. Some will have short-term effects, some maybe slightly longer term. I understood the respiratory teams were looking into creating a post-COVID clinic. That was the last I heard. And actually, we were looking into that from our practice clinical point of view, because we had a few patients we wanted to refer. I'm not sure if Dr. Hill has any further information.
Thanks, Ketan. Can you hear me okay? So yes, I mean, similar reflections. This clearly is a novel coronavirus, a new virus, and it has shown it attacks and affects the body in some very unusual ways from the sort of viruses that we're used to tackling. And I certainly have seen a number of people with quite long-lived sort of after effects after they've suffered with COVID-19, similar to those that have been described in the question. There is certainly, as Ketan reflects, a lot of research ongoing at the moment in clearly excellent establishments that hopefully will give us some answers as to how we best approach in the longer term supporting people. In this short term, general practice is here to support. Please come and talk to our GPs if you are suffering symptoms, and we'll connect you to the services that are best able to help and support. Across our practices, our executive teams and our community teams and general practices have put in a lot of additional supports around, for example, social prescribing and sort of community groups. So there's lots of support to access out there over and above what you may already be aware of, for example. So for people who are out there and trying to cope with symptoms, please come and contact your clinicians, but certainly this is an area we'll need to think about as we move forward, and there's a lot of unknowns still to understand and to work with, I would say. So yes, we are committed to ensuring those with symptoms ongoing get the best possible care, and I'm sure we'll understand more about what those look like as the research teams publish their findings.
Thanks, Ketan. Thanks, Laura. Really good. As I said, we'll get a more fuller answer on this specific question when we publish them. So we're coming to the end of the questions that we have. There is one that says, which again I think is something we'll have to take away and get an actual answer to, which is around, yesterday it was reported that a high number of pharmacies were going out of business. How worried should we be in Crawley? Do you support and value them? So I hope the answer to that is quite obvious around valuing and supporting our pharmacy colleagues. I'll just go to Laura, Dr. Hill, who is a GP in Crawley, but hopefully that almost goes without saying, Laura, but I don't want to say that just in case. So I'll pass over to you quickly.
Thanks, Tom. Yeah, absolutely, completely valued partner as we support our communities. Pharmacists play an ever such a crucial role, particularly as sort of numbers of GPs and nurses faces more pressure. Of course, how we look towards all of the sectors around our community, pharmacies included, how we support and ensure services are sustainable and flourishing is really important. Of course, we don't commission pharmaceutical services, but they're an absolutely key partner in how we support our public. So absolutely have our commitment to doing what we can to support.
Great. So finally, we've had some really positive feedback on the questions. We're coming to the end, but there is one question that I wanted to ask, and this hasn't come from me. This has come from when we've gone out. We've asked our Health Watch colleagues, we've asked other colleagues, our council colleagues, our stakeholders, and I think it is one which is in the mind of all of us, and it's around potential for second wave, and particularly around preparations for those, or how we will respond. So obviously Sussex has responded to the COVID-19 situation. A lot of work has taken place. Thankfully, the initial response at least has eased off, but there is always that potential for a second wave. So I really wanted to pick this up. So I think Adam, you're the perfectly placed to say this around, as a system, around that response to a potential second wave.
Okay, so I'll try and get this one brief, because I can talk about this for quite some time, Tom. So first of all, we will approach this in a very similar way to how we approached the first wave, with all of our system partners working collectively together, collaboratively together, to make sure that we have a singular approach to how we respond to things as they happen. So the first thing is, of course, we've done a massive learning about what did we learn with the first wave, and it's a significant piece we've done, which therefore meant we put the right structures in place, the right ways of reporting with each other. There is always a stock take with myself and each chief executive of the system on a Thursday evening, and we go through where we are with everything that once a week. In the height of COVID, we were speaking 7 days a week about what we were doing to manage that going forward. So we've got a tried and tested escalation process first of all. So the first thing is we've got to describe what we're doing to prevent a second wave first of all. So this is my time to make a plug for everybody listening to follow first of all the Public Health England guidance for how we socially distance, ascribe to what is the national policy for that, and maintain our resolve at times when I know it has been difficult. And on a personal basis, I find it hard not seeing my friends and my family, but we've got to stick with this collectively as a system to make sure we get that right. So I think the messaging of that will be really, really important. Then, of course, it'll be us having the vigilance about seeing areas across our system that we describe as going through exceedance. So where we see increasing numbers of or increasing prevalence of the virus in our system, working actively closely with our local public health colleagues for what we do locally to try and manage, to try to keep our population as safe as possible should we see that situation happening. We have not seen it happen yet in any part of Sussex, but that doesn't mean we are complacent, and already today there are further news reports about other parts of the country that are now going into forms of a lockdown, so we must remain vigilant at all points. Then we have to start looking at some scenarios about what could happen, and we've really tested that across all of our systems about what that means for how we manage this potential second wave. So we have to ensure that we've got the right amount of intensive care capacity. We have to ensure we've got the right drug supply for our clinicians at the front line to treat our patients quickly, with the learning that they learned about how to treat patients with the first wave of COVID-19. We've also learned about how we will have hot and cold sites for primary care, to be clear about how we manage each of those scenarios should they materialise across our system. The other key part we are working on, that was part of the question we had from Councillor Jupp, we've also got to try and get as many people seen in the NHS for their historical care requirements, so that should something happen, we've built in enough headroom for us collectively. And then lastly, we also need to scenario plan if the second wave is significantly worse than the first. We are not working to that assumption, but it will be right and proper for us to test our assumptions to make that happen. And the key way we will do that is to work really, really closely with our local resilience forum partners across the wider public sector to make that happen. There'll also be other things that will be announced essentially from government at the point in time. So should we get a vaccine that works, we will be expected to participate actively actively in mass vaccination of the public to also minimise the second wave. But currently we're not at a point to say that we're ready to put that forward. But once we've got a plan for that, and once we're clear about the delivery of that, we'll then also announce that to the public going forward. So there'll be the things we'll be doing over the coming months, and we are in the constant state of testing our plans, being clear what we're doing next, and then taking that forward. So I hope you get the spirit. Lots of planning, lots of scenario testing, but also no level of complacency. But I sort of am asking there should be no level of complacency with any of us and our population as well, to ensure that we keep our population safe.
Thank you, Adam. That's really good to hear. So that comes to the end of the Q&A. But obviously that's not the only opportunities we have for questions and answers. We always want feedback from the public, from stakeholders, whoever you are. We always want your feedback. To reiterate, our governing bodies are held in public but virtually, so they are live. Members of the public can join our governing body meetings. You're also able to submit questions if you want to, and there are other mechanisms by which you can ask the CCG questions or the wider NHS. We always want your feedback, and we always want to answer your questions. So just to reiterate, with the full answers to these questions will be published with our governing body papers next month. And of that, I'll hand back to Laura.
Thank you very much. Thanks, Tom. So that brings us to the end of our AGM. Another year has passed. Thank you to everyone who has taken time to join us today for the AGM, for contributing to the questions. It's really valued. I hope you found our AGM interesting. You've had a useful insight into the progress that we've made in terms of commissioning in West Sussex over the last year, the challenges and the successes. The 3 annual reports and annual accounts for the historic CCGs are all available on our CCG website, which is there on the screen, www.westsussexccg, all in one word, .nhs.uk. There are also summaries of each annual report and examples of how we've commissioned with our partner CCGs across Sussex over the last year. Looking forward, we've come so far already. There's much more we can do. Areas we want to further improve on, areas we can do more really to tackle health inequalities that do exist across West Sussex within our community. I'm looking forward to working further with our partners, some of whom have been able to join us today. There is a lot of progress, but I hope that this time next year we can tell you stories not just about how we have restored services after COVID-19, she says fingers crossed, but of further achievements as well. So let's stay positive. Before I say a few thank yous, I'd like to draw people's attention again to the big health and care socially distanced conversation, isn't it, Tom, which is currently running across Sussex. And as Tom and Adam both said, really we need to hear feedback on how things have been for people, about experiences of healthcare, especially during the challenges of COVID-19. We'd really love particularly to hear from people who've been caring for others and the challenges that has provided and how we can improve services. You can find out more on the website. And please encourage others who you may know to get in touch and share their stories, good and bad. We need to hear where things need to improve. I know I speak for all of our governing body members to particularly thank and praise Adam Dorr and his executive and management teams, our staff, our partners for their hard work and their commitment, especially during current challenges. This has been a really unique year for many reasons, but the commitment and dedication of our staff, of our teams and partners has been really incredible. So thank you to everybody. Thank you to the public for continuing to stay safe and for joining us today. So everybody, please take care and look forward to speaking again next year. Goodbye.